Hello and welcome to this live Parentune workshop. I'm Jana Kukreja and I'm looking forward to hosting this workshop with Dr. Sachin Satish Shah, who is the Director of Neonatology and Pediatrics at Surya Mother and Child Super Speciality Hospital in Vakar, Pune. Meningitis is a serious infection that affects the protective layer around the brain and the spinal cord. Meningococcal meningitis is caused by a bacteria and it can be transmitted from person to person through respiratory droplets. Patients are known to have rapidly progressed to death, often within just 24 to 48 hours after the onset of symptoms. One in five people may even experience lifelong complications such as hearing loss, brain damage, mental disabilities, or loss of limbs. Meningococcal disease is observed in children under the age of 5, in immunocompromised individuals, in adolescents, and in young adults. Uh, welcome, Dr. Sachin Shah.
Thank you. Thank you for the invitation and good afternoon to everyone.
Right. So, doctor, there have been major improvements in preventing meningococcal meningitis over the years, and one such measure has been a preventive vaccination that can save lives and reduce complications. In addition to this, good hygiene and social distancing of kids from infected individuals is also essential in prevention, from what we've learned. So, let's begin this workshop by asking you. Um, what are the symptoms of meningococcal meningitis and how can parents keep their children safe and secure from this disease?
Okay. So to take the first or to answer the first part of the question, the symptoms of meningitis are are like similar to any severe illness. The illness is progresses very rapidly. Like children have fever, they could be drowsy, lethargic, can have convulsions, and if it's a small baby, the baby might not feed well. And in rare cases, like what we get is like bloody spots on the body. So these are the common things that the parents can watch for. But common things like fever, high grade fever, change in the sensorium, vomiting, convulsions is what we commonly see. To this answer the second part, how can we prevent it? It is by use of vaccines. Like since this is a bacterial meningitis, it can be easily prevented by using vaccines, but in the right age group and right population.
Right. Um, right, doctor, you mentioned the vaccine just now. So, the meningococcal meningitis vaccination is said to be vital for a baby who is 9 months old. Can you tell us a little bit about the reason for this?
The reason is, see, meningococcal disease can happen in all age groups, right from say infancy to adolescence. The disease is very severe in infants, so which means like children who are less than 1 year. And the reason is obvious because their immune system is weak, and any bacteria can like rapidly like overcome their natural defenses and spread rapidly into the body, leading to severe sepsis and meningitis, that is severe infection. So that is a vulnerable age group. The other vulnerable age group is adolescents, like slightly older kids, and again that's because like they stay in crowded places, they might not practice the hand hygiene methods that are advocated, or uh, because of close contacts it can spread. So these are the two vulnerable age groups, and we can easily target the the population, the high risk population, by using vaccination.
Right. Doctor, you just mentioned that, infants tend to have low immunity. So, what are the ways in which the meningococcal meningitis vaccine boosts their or strengthens a baby's immune system?
See, if you look at the whole vaccination schedule or the program as a whole, infants are targeted, be it meningococcal vaccine or any other vaccine, the pneumococcal or even the government of India vaccination programs. They would all start during like the infancy, and then they would scale up the program later on. And again, that is for obvious reasons, because that is the most vulnerable population. If we don't treat them, or in fact treatment is very very difficult of this particular illness, so prevention is better than cure. is the dictum that goes behind vaccination. So if you give a meningococcal vaccine, it will prevent against severe meningococcal disease in these babies like who are most vulnerable.
Right. Right, doctor. I think you've already stated, why a meningococcal meningitis vaccine is important. Uh, but if for all the parents who are joining us now, if you could just reiterate why are children at a higher risk of
Okay.
meningococcal meningitis infection? Because this is a very new vaccine for a lot of us parents. I have, twin 9-year-old boys, and I wasn't aware of this vaccine back when my children were infants. So if you could, enlighten
Okay.
us all about that.
Yeah. See, children, the most vulnerable population is infants. So
Okay.
babies, that means infants, babies who are less than 1 year of age, and that's because their immune system is not well developed. What happens is whatever immunity is there in the first 3 months, it is because of antibodies which are transmitted from mother to the baby. Over a period of time, the level of these antibodies goes down, and then the baby or the infant starts producing his her own antibodies, but it takes time. Until that happens, like till late childhood, their immune system stays weak, so they are most vulnerable to any illness, be it meningococcal illness or loose motions or respiratory tract infection. So that's the most vulnerable population. And if you look at the national database also, the infant mortality is the highest as compared to the under 5 mortality or under 16 mortality.
Right. Right,
Now, let me
doctor.
answer
So,
the second part of awareness.
yeah.
Awareness is like this vaccine has been there like for close to 2 decades or so, I would say. It has
Okay.
been regularly used abroad in Northern American countries like USA, Canada, Australia. Developed countries have been using that. It's only recently, I would say, that like there is more awareness in India, but doesn't mean there is no awareness. Obviously, all over the world there is awareness. Yes, it is limited. In Indian scenario, we have limited awareness.
Right. Uh, Doctor, you just mentioned, the age groups that are, have a tendency for whom this vaccine is important. So, can this vaccine be given at any age?
Correct. Now in India, like this vaccine in India is approved after the age of 9 months.
Okay.
But abroad, the vaccine is also given at 2 months, 4 months, and 6 months, along with the primary vaccination schedule, which is the DPT and the pneumonia vaccine. So, in countries where there is a higher burden of meningococcal disease or cases are common, or like in developed countries, they would start it early, like in Canada or in UK, they would start at 2 months, 4 months, and 6 months. In India, it is approved after the age of 9 months. So, two doses are given after 9 months, at 9 months, and again after 2 months, the second dose is given.
Right. Right, doctor. So there you have it from Dr. Sachin Shah about when this vaccine can be offered to children, starting from 9 months onwards. Doctor, if you could tell us what are some of the common side effects of the meningococcal meningitis vaccination? Are there any side effects, first of all? And if there are, what are the common ones?
Okay. See, as with any vaccine, any intramuscular vaccine, the common side effects which are seen is little bit of pain at the injection site, swelling, and a fever for a day or two. Now, these are common side effects which can be seen with any vaccine, and they are not specific only to meningococcal vaccine.
Okay.
So, these are really mild side effects which can be easily managed by using antipyretics or like analgesics at home. And if
Right.
there is a
Uh,
swelling, we can put ice. So nothing very, no very alarming or serious side effects due to the vaccine.
right. So standard side effects which are experienced post most vaccines.
Yeah.
Right. I think that would be good for parents to hear from an expert like you. And doctor, how are the symptoms of meningococcal meningitis, which is brain fever, compared to a normal fever? So how would parents, distinguish between the two?
That is a very important question, because fever itself can be quite frightening for the parents. The moment they see that the child is having fever, it can be a frightening experience for the parents, and for them it's an emergency, though technically medically speaking We wouldn't call it an emergency. It's definitely an urgency to seek medical care, but it doesn't constitute an emergency. And the reason is most of the fevers are like could be viral in origin. So the common fevers which are due to viruses or something, they are low grade, and the child is like otherwise well when between the fever. So that means like once you give a medicine to reduce the fever, antipyretics, in between those fever episodes the child is well, the child is playing or drinking, also the child would be like passing adequate amount of urine. So if that is the condition, that means though the fever is there, like there is nothing to worry about because it's the child is well in between the fever episodes. In contrast, like when you have a serious illness like meningococcal disease, like that fever will not subside in spite of giving medications, or even if it comes to baseline, the child will still be unwell. So the child will not be happy, like the child will be dull, drowsy, could have other, will not be drinking well, could have other features of serious illness like convulsions, decreased passing of urine. So that is how you would distinguish. So the most important thing to remember is that like how does the child respond to the antipyretics that we give. If the child responds, if you give an antipyretic, fever comes down and the child is playing active well, you need not worry. That means it's a minor, it's going to be if at all a minor illness to begin with. But if that doesn't happen, then obviously there is a high likelihood of a serious bacterial infection.
Right, there you have it from doctor who just described how a parent can differentiate between a normal viral fever in their child and something serious like meningococcal meningitis, which is also known as brain fever. Um, Doctor, bacterial meningitis is, of course, like you described, dangerous for children. So, how exactly does this meningococcal meningitis vaccination offer them protection? In what ways?
Okay, so meningococcal vaccine offers protection against two things. It's not only meningitis. See, meningococcus bacteria itself causes meningitis, and it also causes severe bacterial infection in the blood, which leads and what we call in medical terms as shock. So that means the blood pressure drops and it can have a fatal outcome. So meningococcal vaccine prevents not only against meningitis, it also prevents against this severe bacterial infection due to due to meningococcus. And the efficacy rate of this vaccine is above 95% for prevention of these serious illnesses.
Right. Right, doctor. So, if a child has taken the vaccination, for example, and uh, I know you mentioned that some of the side effects that are commonly observed are very common across vaccines. It's not in particular with this vaccine alone. But if a child has a severe headache following a vaccine, a meningococcal meningitis vaccine, what should parents do at that point in time?
Sorry, I didn't catch the question. If the child
A
has
severe
fever,
headache, a severe headache
headache.
after a
Okay,
meningococcal meningitis
after headache.
vaccine.
Okay. Now, again, the treatment is mostly like symptomatic. So we should treat the headache by giving something like paracetamol or ibuprofen, whatever is available at home, and the headache would subside. As I've said, like after giving these medications, the headache will subside. And as I said, with all minor illnesses, if the headache subsides after giving painkiller medicines, and the child is otherwise and then starts like is looking happy and is playing around, that means there is nothing to worry about. So most of the time, not most, almost always, this is what happens. Like even if they have little bit of headache or body ache, we give them like analgesics, and they are fine after that.
Right. Right, doctor. When it comes to this particular infection, when it comes to meningitis infection, what is the incubation period that needs to be followed in order to build immunity to this disease?
um, this is a extremely important question, because unlike most of the illnesses have a reasonably long incubation period. Most of the viral infections have an incubation period of say 3 days, 5 days, say maybe up to 7 days. But meningococcus has a very short incubation period, so it attacks very rapidly. So the moment it gets into the body, it will spread rapidly. So it doesn't give any time for like the body's own immune system to produce antibodies and attack the bacteria. So it spreads rapidly. Within 24-36 hours, the disease can be fulminant since the onset. And that is one of the reasons like that we have to be proactive, because unless there are antibodies in the body, we will not be able to fight the infection. Because if we take vaccine slightly later, maybe after the infection has come into the body, it is going to take at least 2 weeks or like 7 days for the antibodies to form, and by that time it's too late. So for meningococcal, for prevention against meningococcal disease, we need to have enough antibodies in our system. When the bacteria gets in, only then we can fight it. Am I clear on that, or do you want me to explain that once more?
No, I think that was fairly clear, doctor. That was fairly clear. So, but another follow-up question to that is, what are the essential preliminary steps that one needs to take against meningococcal meningitis?
Okay. See, to answer that question first, what are the common signs and symptoms of meningococcal meningitis? How would parents recognize that my child has a severe illness? See, if they see that the child is lethargic or is having high grade fever, has convulsions, then obviously they should seek medical care. They should take their child to the hospital. uh, that is most important thing, to the ER of any children's hospital or any big hospital which is close to their house, because only after thorough evaluation the doctor will be able to tell them whether this illness is severe or this is just a mild like fever related any other minor ailment. So they will have to access healthcare if they see these signs and symptoms. Now, preventive measures are only that, like you access healthcare immediately. The moment we suspect meningococcal meningitis as a doctors, from the history, from the examination, then we have to start antibiotics, and that is most important.
Okay.
And we start with cephalosporin group of antibiotics or penicillin group of antibiotics, which are very effective in treating this bacteria, and obviously supportive care like oxygen and other medications.
Right. Doctor, we've spoken about meningococcal meningitis, but this particular bacteria, does it also cause other different illnesses? And if yes, could you tell us a little bit about them?
Yeah. So yes, in fact, it causes like severe bacterial infection in the blood. So what we call as sepsis, or that is bacterial infection in the blood, which means the bacteria circulates in the blood, and then it goes to all other end organs or vital organs like liver, brain, kidneys, and it will cause damage to these organs, and ultimately these organs will stop functioning. So that is, in fact, that is more devastating, and this is life threatening complication because of meningococcus. And it has this unique ability to spread very rapidly. The moment it attacks the body, it will spread rapidly and destroy everything that comes in its way. So it's a very virulent bacteria.
Right. And with respect to meningitis, what are the different types of meningitis that are seen in children?
Okay. See, historically, we see meningitis. There are two types. There are meningitis due to bacteria. There are meningitis due to viruses.
I see.
So the common bacteria which cause meningitis are like, one was pneumococcus, second was H. influenzae, and third is meningococcus. So these are the three common bacteria which cause meningitis in children, especially who are less than 1 year. Now there is a lot of awareness, like the government of India has incorporated H influenza vaccination into its national immunization program, and now they have taken up vaccination against strep pneumoniae, which is the other second bacteria which causes meningitis, in national immunization program. So now what we are seeing is the incidence of bacterial meningitis due to these organisms is going down. But now what remains is like meningococcus, because like we are not offering any protection against that. So over a period of time, like this might become the dominant bacteria which is going to cause bacterial meningitis.
Right, doctor. I think you've told us a lot about the bacteria in particular and the ways that this can be prevented, or the primary steps that need to be taken. We have a lot of parents joining us, and they also have a lot of questions for you, doctor, related
Yeah,
to
sure.
meningococcal meningitis. So our first question comes in from Manat. Manat would like to know, how can the effectiveness of the meningococcal meningitis vaccine be measured in terms of percentage? How effective is it? And once administered, is it possible to ensure that the child would be safe from this disease for the entire life?
Okay. See, the vaccine is whatever trials have been done, like before the licensure of this vaccine, they have shown that the effectiveness of this vaccine is close to like 95%. So, in more than 95% of children, there would be protective antibodies against this particular bacteria. Now, these antibodies and studies have also looked at like for how long these antibodies last in the system. So, in most of the studies, the antibodies last for at least 5 years, and after that, the level of these antibodies start going down. So, what is recommended that if there is a high risk population, like I will not go into the medical this thing, but in a high risk population, you can think about repeating the vaccine after 5 years. But if you give it in the most vulnerable population, which is infants, 2 doses are sufficient, because that's the most vulnerable population for meningococcal meningitis. And you
Right.
can repeat another dose if needed during adolescent period also. That's what like the developed countries would be doing.
That is what they recommend.
Yeah. So
Okay.
in United States, they would give 1 dose after 16, or if they give 1 dose after 10 years, they would repeat again at 16 years of age.
Right. And
See,
thereafter,
every country has a different schedule. Like in UK, the burden of meningococcal disease is very high, so they give it for 2 months, 4 months, 6 months, and then
okay.
they might repeat it during adolescent. Same thing
Un-
happens in Canada: 2 months, 4 months, 6 months, and again repeated during adolescence. So every
right,
country has, yeah, a different schedule.
understood, doctor. So, India's recommendations, keeping in mind India's recommendations, adolescence is the last time that they recommend administering this vaccine. Thereafter, there is no such recommendation.
Yes.
Understood. Understood, doctor. Doctor, we also, went over the fact that immunocompromised individuals are also more susceptible to meningococcal meningitis. So, for such immunocompromised individuals, is there any particular recommendation?
Yes. See, immunocompromised host or immunocompromised children is a different ball game, because the name itself, they are immunocompromised. Now all children are immunocompromised, but some are more immunocompromised than others. So like when we talk about, these are the children who have got, say, leukemia, lymphomas, they are receiving chemotherapy, or they have inherent defects in their immune system because of which they cannot fight infection.
Right.
So in those children, it is mandatory. I wouldn't say it is recommended. It is mandatory to give meningococcal vaccine along with other vaccines which would prevent like invasive bacterial infection. So not only meningococcus, we give many other vaccines to these children.
Right. Right, doctor. Thank you for that clarity, doctor. Our next question comes in from Sunita. Sunita says, "Hello, doctor. I have two children and I've heard of meningitis vaccination in recent times. So, should I get my elder child vaccinated against meningococcal meningitis?" Sunita has not mentioned the ages of her children.
Yeah. So elder, like, if definitely you should, if he is more than 10, then you should take the meningococcal vaccine now and repeat it at the age of 16 years. If your child is like above 16, then single dose would suffice.
Understood. Understood. Sunita, I hope that answers your question. So, based upon your child's age, you can opt for the vaccine accordingly. Um, Our next question comes in from Ria. Ria would like to know, how long does the immunity from this particular vaccine last, from the meningococcal
Okay, so
meningitis
again, to
vaccine?
re-emphasize, see, none of the vaccines for that matter give you lifelong immunity. We have to understand that. So the vaccines would help us when we are most susceptible to the disease. So usually the immunity for any bacterial vaccine would last for 5 to 6 years. And after that, if you are going to be susceptible, then it is advisable to repeat the vaccine. If you are not susceptible, if your own immunity is capable of defending against this infection, no need to repeat that.
Right,
So same
understood.
thing holds true for meningococcal vaccine also. Like so, the efficacy is for 5 to 6 years. So a booster dose is recommended only in immunocompromised hosts, not in normal hosts or normal children.
Right, right. Ria, I hope that answered your question. As per doctor's expert advice, it a booster dose would be only required in those who are immunocompromised if they're at that age group, and if they have immunocompromised health. Um, and the efficacy would be about 5 to 6 years, as per doctor. Our next question comes in from Nandini. Nandini says, "Hello, doctor. I have two children, 5 years old and a newborn. And are there any different signs in this disease when it comes to newborns versus older children? And how fast can it be contagious versus the risk rate?"
Yeah, very very important question. See, in let me take the easier part. Like diagnosing any infection in a newborn is very tricky, or rather, I would say not diagnosing, differentiating viral illnesses from bacterial illnesses can be really tricky in a newborn. And the reason is the signs and symptoms are very non-specific. So the common signs that you see, like they would not feed, they would have fever, not feeding well, might be a little bit lethargic, could be extremely irritable. Those are the common signs that you would see in a newborn. And those are signs of a severe illness. They are not specific for meningococcal illness. So these are the signs which are there, which could be seen in any sort of a illness, but then they alert you to the fact that okay, that the baby needs to be examined by a doctor to differentiate, or to whether we need to do additional investigation, whether we need to observe, or uh, what else needs to be done. When it comes to a 5 year old, like this again, the signs and symptoms are different because there, like the infection is more localized. It is he will have the child will have symptoms like high grade fever, headache, vomiting, convulsions. So they will have like more focused signs and symptoms as compared to a newborn who will have like very non-specific complaints.
Right. Doctor, and the second part of our question is how fast can it be contagious versus the risk rate?
Well, it is contagious. It is contagious because it spreads by a droplet infection, and it usually like it will spread from the elder one to the younger one, and not the other way around.
Understood. I hope that
And the
answered your
incubation
question.
period is very short, of 24, 48 hours for to disease to evolve.
Right. Right. So the you Nandini, you heard there from doctor that it is very it spreads at a very fast rate, just 24 to 48 hours. Our next question has just come in from Ruby. Ruby says, "Namaste, doctor. I have a 5 year old child. So, what age group is usually affected by meningitis, and what percentage of kids in this age group are usually prone to this?"
Uh, Age group, infants are most susceptible. There are two age groups which are like I would say at the extremes of the pediatric age group. So infants less than 1 year and adolescents. They are the two age groups. Very easy to remember. Extremes of ages are susceptible to meningococcal infection.
Right. And she wanted to know what the percentage of children affected by this would be
Okay,
in those
that's a very
susceptible
good
age
question.
groups.
Very good question. Excellent. So, around when you look at the Indian data, which is not much, anywhere depending on the incidence of meningococcus bacteria causing severe bacterial sepsis, would be somewhere around 3 to 4% in hospitalized children that I'm talking about.
Right. I hope that answered your question, Ruby, about the percentage of children that are prone to meningitis.
See,
Uh,
well, I would like, if you want, I can just talk a little bit of medical jargon, which will confuse you. But the thing is, it is very difficult to isolate this bacteria or difficult to grow this
Okay.
bacteria. So you need to have a
Okay.
high index of suspicion and specifically request for a test for this particular bacteria. Only then the lab will be able to isolate that.
Right.
So
So
the
only
incidence we
confirmed
don't know, real
cases
incidence we don't
are
know, it might be higher.
understood. Understood. So we are talking about the tested cases that have been
Yeah, yeah, yeah.
confirmed. Right. Doctor, we have another question that's coming from Sandhya. Sandhya says, hello, doctor. How many doses are required for this vaccine for a child below 5 years of age? And does the vaccine come with a name, a particular name? As if I get one dose administered from one doctor and the other from some other doctor, will it have a difference in its potency and its effect on the baby?
No, the vaccine effectiveness doesn't depend on the doctor, right? So,
Okay.
that
I
was on a
think what she
lighter
meant to
note.
say, are there different varieties in this
No,
particular
I was
vaccine?
just, that was on a lighter note. That was on a
Right.
lighter note. So what, say you should not change the brand, right? You can change the
Okay.
doctor, but don't change the brand of the vaccine that you are giving. Then that would not affect the effectiveness. Now various brands are available. Now we are not here to do brand promotion, but
Right.
the vaccine is approved after the age of 9 months. So if you are giving it at 9 months, then only two doses are needed. You can give one dose at 9 months and the second dose at 12 months. If you
Right.
are giving after 2 years, then only single dose is needed. So there are two brands which are available. One brand is approved after the age of 2 years in India, and the other brand is approved after the age of 9 months in India. So when you go to your doctor, you should ask them what brand they are giving, so that then you remember, you next time, like if you are giving, you will give the same brand.
Right. So don't change the brand. That's doctor's advice. I think your immunization record of the child will also have a sticker uh, put there which would mention which one to continue with. So if even if you've changed your doctor, they should be able to make reference to that and offer you that one. Uh, right. So we have a question that's coming from Pooja. Pooja says, hello, doctor. I'm going to shift to Canada in the next 10 days. My baby is 7.5 months old as of now. Can I get this vaccine administered now itself, as it won't be possible for me to do that after this? Also, if it's not possible here, will the same vaccine be available there, as the chances of the same disease being prevalent there are very low? So please guide me on this.
Yeah, uh, very interesting. See, unfortunately, the vaccines which are available in India are the same vaccines which are available in Canada also.
Okay.
The same brands are available. But unfortunately, what is approved there after the age of 2 months is not approved here. One brand is approved after the age of 2 years, other brand is approved after the age of 9 months. So since they are not approved and they are not for medical reasons, they are for other technical reasons. Even though they are medically safe, no pediatrician will give you the vaccine because the child doesn't fulfill the criteria as laid down by Indian Academy of Pediatrics. So my suggestion would be that it is, you have no option but to take this vaccine after you go to Canada. Though technically both the vaccines which are available in India are the same ones that the Canadians would use.
Right. I hope that answers your question, Pooja. You won't be able to avail this considering you're shifting in only 10 days and your baby is 7.5 months old. You're going to have to wait and go to Canada and receive your baby can receive this vaccine over there. We have a question from Mohan, जो बिहार से हमारे साथ जुड़े हुए हैं. वो कह रहे हैं कि वहाँ क्या बिहार में ये वैक्सीन सरकारी हॉस्पिटल में उपलब्ध उपलब्ध होगी या मुझे प्राइवेटली ही लगवाना होगा ये वैक्सीन, और कितनी बार लगवाना होगा 9 महीने के बच्चे को ये वैक्सीन? कृपया
Okay,
मेरा मार्गदर्शन कीजिए.
ओके. सो ये सरकारी नेशनल इम्यूनाइजेशन प्रोग्राम जो है, उसमें ये वैक्सीन अभी तक तो आई नहीं है. तो आपको ये प्राइवेट सेक्टर में ही मिल सकती है, और इसके आपको दो डोज लेने पड़ेंगे, एक 9 महीने पर और एक दूसरा डोज है वो 12 मंथ्स पर लेना पड़ेगा.
मोहन जी, डॉक्टर ने आपके सवाल का बहुत ही क्लियर जवाब दे दिया है. तो आपको प्राइवेटली लेनी पड़ेगी ये, और 2 डोज जैसे कि डॉक्टर ने आपको बताया है. Our next question comes in from Rekha. Rekha would like to know what is the incubation period for each of these organisms and what is the transmission route.
Uh, the incubation period of this organism is very very short, and that is why prevention is of paramount importance. As I talked about earlier, like the incubation period is as short as 36 hours, 24 to 36 hours. So that means once the bacteria gets into your body, it will spread rapidly and damage all your organs. It's a very virulent bacteria with a very very short incubation period.
Right. And the other part of the question was the transmission route.
Transmission.
Route. The how is
Ah,
this bacteria
by the
transmitted from
respiratory droplet transmission.
right. So it's a person to person to
Person to
person
person transmission would be there.
through respiratory droplets. I hope that clears your doubts, Rekha. Our next question is from Surbhi. Surbhi says, "Hello, doctor. My friend's daughter is 2 years old. My friend has heard about this brain fever, and she would like to know: is it very harmful, or would this fever have long-term implications on a child's health? And is this vaccine compulsory for every child?"
See, these vaccine is not compulsory because it's not part of the national immunization program. So the government doesn't make this compulsory, right? So it is definitely voluntary. After the parents have to look at the pros and cons and then decide about taking the vaccine. So for that they have to discuss with the pediatrician. Now, the thing, what was the other? That was the last part. And what was the first part of the question?
Does it
Should you
have
take
any
it? Should
long-term complications, implications on a child's health, and how harmful
see
is
the
this
illness
particular?
itself? The illness is very very harmful. It can be life threatening, right? That is the worst part of this particular illness. And though those patients who survive, they have a chance of disability, a very high chance of disability. There is nearly a 20 to 30% chance of disability in survivors. So it has a very high mortality, and at the same time, the risk of disability is also high because of this illness.
Right. I think you've already just addressed some parts of the next question, but we are going to go over this nonetheless because we have parents joining us regularly. So the question comes in from Sejal. She says, "Can there be any long-term effects of brain fever like this, even if my child recovers from it? And my baby had got high brain fever a month back. Is there any way to
My
know
baby
now
had what?
whether this was meningitis?"
No, no. First is the long-term the side effects due to meningitis. And what was the second part? My baby has recovered from.
From a high brain
I
fever.
didn't.
Sejal claims that her baby had a month ago had high brain fever. And is there any way for her to know whether this was meningitis and could this cause any long-term or later effects in her child?
Okay, okay. See, meningitis. When I'm talking about, like, we are talking about meningitis due to meningococcus. Meningitis due to meningococcus is a difficult illness to treat, which has a very high mortality. And as I talked about, like the morbidity, which means like long-term sequelae, like paresis, mental retardation, convulsions, or fits, the chances of those things happening are very high, nearly 20 to 30%. Now, to answer the second part of your question, like my child had high fever, meningitis, like only your doctor will be able to tell you whether your child had meningitis, because viral meningitis also happens, and most of the viral meningitis patients, they recover without any sequelae. But unless you do a CSF examination, that means like we check the fluid between the in the spinal cord for bacteria, we will not be knowing whether there is meningitis or not. And the other diagnostic modality that we use is MRI. So unless we have these two tests, like which a doctor would do if he suspects meningitis, it is very difficult to make a diagnosis only on clinical basis.
Right. I hope that answers your question, Sejal. It would be very difficult right now to determine whether that was meningitis or not. Doctor, for all those parents who are joining us at this juncture of the workshop, if you could, reiterate what are those three key points that they need to remember with respect to meningococcal meningitis, and in particular the vaccine? What would you like to, draw awareness to for parents?
Okay. See, meningococcal meningitis or meningococcal illness is a severe illness. It can be life threatening. That is what they need to remember. So, if they should opt for vaccine, again, since the vaccination is not compulsory, it is always a good idea to protect against meningococcal meningitis, since the time frame for intervention is very, very short. Like hardly there, sometimes there might not be enough time to treat also. The bacteria spreads so rapidly. And so, if you think about giving meningococcal vaccine, earlier the better. So, start it during infancy because that is the most vulnerable age group. Third thing, the side effects because of this vaccine are like negligible. The adverse effects, I would say, not the side effects. So, adverse effects of meningococcal vaccination are same as any other vaccine that we take, and so that should not deter us from taking this vaccine.
Right, doctor. So basically, Dr. Sachin Shah has just told us about the importance of the meningococcal meningitis vaccine, at what age it needs to be offered to children, the most susceptible age groups, and how, the side effects of this vaccine are very minimal. So that's always, a reason, all the more reason that, especially, children who are most susceptible, whether they're infants or adolescents, they need to opt for this vaccine, because the like doctor mentioned, the effects of this disease, this bacteria, can be very fatal, and the uh, the duration in which it transmits from one patient to another is very short. Keeping all that in mind, I think all of us parents have been educated about the importance of this vaccine. Thank you so much, Dr. Sachin Shah, for joining us today and helping us spread all this awareness about the meningococcal meningitis vaccination.
Thank you, everyone. Thanks, Jarna, and thanks to all the parents for the lovely interaction.
Right. Have a good day.
Thank you.